Hey everyone. In this episode, we're going to be talking about handling patients that present in the clinical setting with dental anxiety or phobias. And this is probably more widespread than you realize. Lots of patients come into the office and we are not their favorite people. And I know this is really hard for you to recognize. For some patients, they dread it. Some patients we don't even meet. We don't even see them unless it's an emergency. And the basis for all of that is usually some kind of trauma experience or high dental anxiety that these patients experience. So you need to be equipped to be able to handle patients that really need your care and love and compassion. How do I deal with my anxious patient? How do I support them to walk them through the process of care so that they can successfully manage the needs that they have as far as their dental needs are concerned? That's what we're going to talk about today. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Well, it's probably no surprise to you that most patients handle dental anxiety by avoiding going to the dentist entirely. And I want you to just recognize that anxiety is not just a feeling, it's actually a physiological state that affects our health just as much as anything else, right? It's actually a comorbidity. It's right up there with obesity, and nutrition. So I want you to really recognize that it's important for us to look at anxiety as having a real impact on our patients. Remember, you can listen to the autonomic nervous system episode that I have to really help how the brain works and how it impacts the organs and tissues, from how our heart rate is, what our blood vessels do, that whole fight, flight, or freeze mechanism that is built into how our body protects itself. All of these factors play into understanding what our patients are thinking and feeling when they are confronted with a dental appointment. A threat. We are looked at by these patients as a threat to them. And there is a physical response. The body physically and emotionally responds. And this might be hard for us to understand. Many of us are very comfortable in the dental office, but there are people that can't even handle the sight, smell, thought, or discussion around going to the dentist or the word dentist or discussing anything dental. They get a rise in their blood pressure, their heart rate increases, maybe their palms will get sweaty, they'll change their breathing rate, their muscles will tense up. This is the body's way of responding to that stress. And the body releases toxic hormones and the inflammatory channels are initiated. Small doses of this is okay, but consistent doses cause things like headaches, all the way up to very stressful cardiac issues. We want to be able to prevent those potential medical emergencies. And I know most of you are learning about medical management of the dental patient and how to keep those risks at bay to make it through an appointment successfully without having a medical emergency. And part of the process is understanding the prevention side. not response and reaction side to a medical emergency that occurs. You want to try to prevent the medical emergency at the highest level in the best way possible. So it's no surprise that a patient who experiences high anxiety has some problems in the dental chair. Fear adds to our impact. I just want to just throw this out there that our patients that have dental phobias or dental fears, they are the worst versions of themselves when they are sitting in your chair. And I've noticed that most of them cannot hear most of what you're talking to them about. So the impact that you have on them in the actual operatory is very low. You really can't have effective communication with them because in their mind, in their body, they're on survival mode. They've got their guard up. And so anything that you're trying to give them, maybe you're trying to instruct them on something, there's like a block. There's a painful block for them because they're on survival mode. So you just want to keep that in mind. I've seen where I talk to a patient in the operatory and maybe they're hiding their stress a little well, so I might miss some of the cues from them that they're hearing what I'm saying. And then the minute we leave the operatory and we walk out to the reception area, it's almost like a switch. They almost change into a different person because now they've finished whatever trauma or drama was going on for them and they can relax. They can calm down a little bit. So look for that in your patients. Look for that change in who they are. So when you go out to get them in the reception area, that's when they're going to peak in their anxiety. And when you bring them back into the operatory, that movement down the hall or down into the room and sitting in the chair, that can be a lot for some patients to deal with. I assure you that when they're leaving, when they're done with the appointment, that's when you're going to see the change in their energy. And so then sometimes things might be better said outside the operatory for those patients. So people respond in certain ways when they're exposed to an anxious situation. One of them is to stop listening, like I said. The second one is to just avoid completely. They are going to get through this dental emergency, and you are never going to hear from this patient again until they have another dental emergency. Even though you know that if they could come for preventive services, they could avoid the potential of having another dental emergency down the road in the future. And then they could turn it around and have more of their dental appointments be a positive experience, which will in turn reduce their dental anxiety. And experiences are important for these patients. What's so hard is that is the reaction of some of our patients is they come for an emergency. It's a harder procedure for them because they're in pain usually. Their anxiety level is really high, and their response to going through the situation is to not go through it again until they absolutely have to. Another way that patients respond, which you want to be aware of, is they can get agitated or angry and reject communicating with you. And this causes stress for you and the patient. As hard as this is, I don't want you to take this personal. You have to remember that that patient is really trying to deal with the conflict that is going on inside of their body in that moment. So they're either going to stop listening to you or not have the ability to communicate with you, or they're going to get angry or agitated with you, or you're not going to see them again unless they have another emergency. And that's okay. The key is, okay, how are we going to deal with this patient? And what is the best way I can present the treatment and perform the treatment on this patient that will help them in the future? Because you know you are perfectly capable of working with these patients. The key is to always focus on the positive. Play down the negative. Don't point out that that patient is agitated. Don't point out that they seem angry or irritated. Don't let them know that you notice they're not listening, and certainly don't say, I'm probably not going to see you again, right? These are things that you don't want to talk about because they really need your positive reinforcement. So find something that they are doing well. I'm so happy you're here. I'm so happy you're here. I'm so happy you're here. This is a really nice way to provide positive reinforcement for your patient. The other thing is when you have to give them information that might spike their anxiety level, also allow opportunity for you to give them some reassurance. You do have a couple of restorations that you need on that upper left quadrant, but they're relatively small in size, and the dentist can provide you with local anesthesia so that you're nice and numb and comfortable during the procedure. And the procedure shouldn't take very long. And I know that you can do that. You have been very helpful today when we took that x-ray, so I know that you can do this. Give the good side of every scenario of treatment that that patient needs and provide an opportunity to give them that reassurance, because when they hear that they're doing well, they're a good patient, you're doing such a great job today, it really helps remind them that they can believe in themselves. Part of the problem of their anxiety is that they don't think they're a good patient and they don't want to put you out. As the provider, you need to put your best foot forward and let them know that you are here for them. You care about them and you're trying to meet their needs. Provide them with that positive reinforcement and don't even say anything about how their negative behavior is going. Honestly, they don't even recognize that they're behaving in that way. Anxiety affects our health in a negative way, and poor dental health outcomes also impacts our overall well-being. Building confidence with your patient, right? I tell you guys about your mantra, you can do hard things and you got this. You're capable of many, many things. You can use those same mantras on your patients. Little by little, a little becomes a lot, as they say. Your patient might have a really large treatment plan that they have to tackle. How about talking to them about one at a time, one step at a time? We're going to do this together. I can't wait to see you again. I'm looking forward to our time together. You did such a great job today. Even if in your heart you are exhausted after seeing this patient and the vibe and energy that came off of that patient just wore you out, if you focus on the positive, it's really going to help build that rapport with patients. And I have to tell you, these are some of my favorite patients to treat in the dental setting. I look at the high anxiety patient as like that challenge. How can I take whatever happened in this person's past and completely erase it so that in a short amount of time, you're not even going to recognize this patient as an anxiety patient. Maybe this is a patient who needs to be medicated in order to do anything in the dental office. Over time, with your positive reinforcement and affirmations to that patient, they start to build confidence and belief in themselves. And then before you know it, they're doing it. And they provide you with the feedback that you helped me overcome this dental anxiety. You helped me overcome the fear. You helped me improve my health. You helped me. And this is what we live for. This is what we're designed to do. Make sure that when you're communicating with your patient that you're not creating more anxiety. Don't point out their anxiety. They think they're managing it in their head. They think that they got it under control. So don't point out their anxiety. Just know that in time, you can confirm if they bring up their anxiety. I'm just so anxious. I have such a hard time at the dentist. You are going to give positive feedback. You're doing such a good job today. I'm so proud of you. I believe in your abilities. You've got this. These are all positive affirmations that your patient really needs to hear. They don't want to hear, yeah, you are a difficult patient. Yes, you are. I can tell you're really anxious. Yeah, this isn't fun for you. Me either. Something like that would be so terrible for our anxiety driven patient to hear. They really need your love and kindness to guide them through the process of care so that they can build that confidence that they need to get well and to stay well. Can you imagine what it must be like for somebody who has gone a long period of time without seeing the dentist and now they have pain and they have to try to overcome their fear and go into the dental office and face their fear? Like, I think about my fear. I have a fear of heights that I'm trying so hard to say, okay, I can manage this fear of heights. I get so much anxiety. If I think about how a patient feeling like I feel when I'm on a ladder, oh my goodness, that just makes my heart ache. The situation of a patient feeling like I feel when I'm on a ladder, what I need is somebody saying, you can do this. I got you. You're doing such a good job. Come with me. I believe in you. You can do this. We can do this together. I'll help you. That is exactly what our dental patients need. And honestly, that is exactly what I would need if I were to go on. So I work with a couple of ladies who have done the zip lines, and I'm like, man, that sounds like so much fun. I really want to go. And then that little inner voice of anxiety pops in, and I'm like, oh, but I'm so afraid I'm going to die, right? And this is truly what our patients feel when they think about a dentist visit. So for them to be provoked by pain and then to go in pain and have to face that fear, my heart just aches for those patients. So I want you to put yourself in a scary place. Remember that show that used to be on? It was Fear Factor. Fear Factor would take people's biggest fears and they would have to try to overcome those. So I want you to think about your own personal biggest fear that provides you with a high level of anxiety. And I want you to think about that for your dental patient. Imagine what it must be like for that dental patient when they come into an office, if that's what they're feeling on the inside of their body. That's what I do when I think about my fear of heights and going down a zip line, that I know that with the ladies that I work with, that they're going to give me the confidence and the positive affirmations that I need to probably do it and face that fear. And you know what? At the end of the day, I'm probably going to look at them like those are my two superheroes and they are rock stars because they help me overcome a fear. Your patients will just simply love everything that you do for them because they will recognize that you were patient with them and you helped them through the process of overcoming a fear that they have. So if I can leave you with that, you want to make a difference in the lives of patients and their oral health needs, that's exactly how you want to do it. You lead with compassion. Let them know that you love them, you believe in them, you care about them, you want them to be healthy. You can help them through that process of care and get them down the path of health where they need to be. And it is okay to share a fear with your friends and say, hey guys, this is how I feel. How do you feel? And how would you manage that with one another? Take it right outside of the dental operatory so you can really think about fear and how that makes your body feel. Because as a dental person, you guys probably don't have much dental fear. So I want you to think about a fear that you have and what that does to your body and how that makes your body feel. This is real stuff. These are real physical reactions that our patients have. And so how we manage those patients really matters for their dental future. If you just go in there and you treat them in a way that just exacerbates their fear, you're not meeting their needs and you're not helping them overcome these obstacles to achieve better oral health outcomes, which is your goal. So make sure that your actions and your plan for your patient aligns with your goals. Good luck, guys. I hope you guys recognize that you have a lot of people in the field that are cheering you on, that are on the sidelines, supporting you, guiding you, and they're there to help you. On this journey, there's going to be lots of bumps, lots of questions, lots of concerns, lots of celebrations, lots of things to be excited about. Pat yourself on the back. Be kind to yourself. People like myself are right there to help you through those challenging times and to celebrate with you when you have a win. I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.